same one. Subhead, despite the family tragedy, though, this is the father of the quite young lady who died tragically, is still urging residents to get their jabs. And let's go on and see what's the main angle taken on the bereaved father, whose name appears shortly. He says, I think people should be given the true figures on how many people have had issues with these blood clots. I don't think we actually know the true numbers. I just want some transparency. Notice, Mike and Brian, that this isn't in the subheader. Let people make their own minds up. Direct quote from the bereaved father. I want to know what Vanessa's cause of death was, his daughter, but she was fit and healthy and had no underlying symptoms at all. So why did this happen? I know the government's saying the vaccine is safe and these clots are rare, he adds, but when you're sat in a crematorium with 29 other people, because the 1 in 100,000, well, it's a bit more than that if you look at the yellow card data, is your daughter, it's not the same. Now let's go and have a look at the zoomed in version of this. And of course, a lot more readers should be doing this with their local newspapers and communicating with us about their findings. So the right-hand inset on the original shot was clear jab message despite tragedy. This I managed to transcribe the key bit of for clarity of reading. Phil Jones's daughter, Vanessa Newton, died aged just 45, a few weeks after she had had her first dose of the AstraZeneca COVID-19 vaccine, says the editorial comment on the same page as the readers' letters. He is firm, this is not all of what the father said, Mr. Jones, but it's what they're deciding to spin. He is firm that this story should not put anyone off getting a jab to slow the spread of the Delta variant of the novel coronavirus. Hold that in mind, given what we're going to cover later in the news. Residents should take heed of Mr. Jones's word, says the comment, especially if they are wavering about having a COVID-19 vaccine, and should book an appointment when they're given the chance. So very questionable methods here, and I'm not suggesting that the same person wrote this that wrote the much more favourable and balanced coverage on the left-hand page, the actual write-up of the interview with Mr. Jones. But this is a prompting, really, to many of our viewers in Britain, or indeed wherever you are, to look at your local press coverage and speak directly to I would say, the editors than the journalists themselves, to give cut the journalists more slack. And where the editors are saying you ought to be getting the jabs despite the risks, and almost putting words in the mouths of the interviewees which were not there when the original write-up was done, then you need to be getting on their case about that. Otherwise, it won't happen.
Indeed. I think that's a pretty outrageous editorial because, of course, it's absolutely not what the gentleman said.
Okay, well, let's move on to this. Now, back in March, we told you all that the MHR had appointed Dr. Alison Cave as its Chief Safety Officer. Now, just to make it clear and remind everybody, this is a new role. This role did not previously exist, so the MHRA did not have a Chief Safety Officer at the time that the COVID-19 vaccines began the rollout. Well, she has been taken up her role, I think, on Monday. Today, I start my new role as the MHRA's Chief Safety Officer, where my work will begin immediately. I'm joining at a time, she said, in which the scientific, technological, and analytical landscape is rapidly changing. I look forward to working with colleagues at the MHRA to continue to improve our medicines and devices safety surveillance in the UK. So this is all about safety surveillance. I'm not sure what that has to do with safety itself, but anyway, it's about surveillance. Hopefully we're going to see, therefore, now that she's in post, a massive upgrade in the quality of the data which is coming out of the MHRA with respect to the COVID-19 vaccines, because at the moment we can only say that it is not fit for purpose. And just to remind you, Alison Cave then she's a pharmacologist. She's got a PhD in biochemistry. She has worked for the Medicines Control Agency, also the MHRA. She's worked at the European Medicines Agency, at Innovate UK, at the Wellcome Trust, and at King's College London. So that's a bit of her background. And Brian, hopefully we will see an almost immediate upgrade in the quality of the data that comes out of the MHRA.
I think we'll see an increase in the amount of talk about safety, but we won't actually see the evidence to support it. What we do need to talk about at this point is sin. So let's talk about sin. What are we talking about? Well, not what you might think, because the sin is the Science and Innovation Network. And we've been paying attention to quite a lot that's been going on behind the scenes with government. So let's take you to this. So this was published on the 16th of April 2019, but it was SIN France organises the first UK-France bilateral workshop on behavioural science at Paris British Embassy, an impact story about how SIN France initiated UK-France cooperation on the use of behavioural science in health public policies. So I wonder, in that local paper, when we started to see the editor overriding what was truth by giving his own opinion rather than the opinion of the person writing in, was that the use of applied behavioural science in that local paper? Who knows? So what have these people been up to? Well, this is a bit more detail. On the 7th of February, the Paris British Embassy SIN team organised the quote, influencing behaviours through science, UK-France perspectives. And this was all done at the British Ambassador's residence. Does that remind you of anything?
It reminds me of the Franco-British Council and the Defence Pact that came out of that. But just that was 2019, of course.
Yeah.
Yes.
Yeah. And so the piece here goes on to say the aim of the workshop was to establish dialogue, share knowledge and experience, as well as promote cooperation between the UK and French experts at the academic and policy level. And it goes on, it's thanks to a Paris-hosted dinner in the ambassador's residence that this workshop came about. The September 2017 dinner in honour of Chris Whitty, Chief Scientific Advisor to the Department of Health and Social Care, gathered several French health experts from government, policy, academia and industry. The dinner bore fruit in three particular areas: genomics, health data sharing and behavioural science. So these are all topics that the public at the moment in UK totally unaware of. High-level policy meetings going on, UK public not told at all. So let's have a look at what they were dealing in. Genomics, first of all, the UK and France, it said, started collaboration in 2017. Genomics England and Avian, France's National Health Alliance, signed a joint collaboration document in 2018 to, quote, co-fund new technologies to accelerate genomic medicine and research collaboration. And I'm going to suggest a lot more work to be done, but I'm going to suggest that the whole of the vaccine drive is tied in with this drive for genomic medicine, but we'll see what evidence comes up to support that statement. Health data, both the UK and France have placed access to data across the health research and R&D, research and development community, as national priorities, not keeping people healthy, but we're going to grab their data. SIN France is working with relevant parties in both countries to establish dialogue and explore potential cooperation in an area designed to build a more innovative and efficient health and care system. So we're not going to help people get better, we're just making a more innovative system. Meanwhile, the carnage goes on. And this one here, applying behavioural science and social science in health. Apparently in the February 2019 Paris workshop, expert scientists and policymakers met for the first time to discuss the use of, quote, behavioural science and evidence-based policies in government and public policy to answer this question: how can UK and French scientists and experts work together with policymakers to produce the most effective evidence-based policies? So I just want to reinforce it with this. Was the UK public ever told that the NHS-based healthcare system had been replaced by SIN? And of course, the answer is not. But this is the way that politics are conducted, so the public never informed. In fact, politicians in Westminster never informed of the true policies. And if we just join this together with the start of the news, where we're looking at how media manipulates what's happening, let's bring in BBC Media Action. We're going to be talking about them a little bit later. But here was their headline from 2016. Can mass media cause change? A randomized control trial finds out. And this is what they had to say. Can the mass media cause changes in an audience? Can the mass media cause changes in an audience's knowledge, attitudes, and intention to practice behaviours? A BBC Media Action, we have just successfully conducted a randomized control trial to investigate this chain of causality in a primetime health TV drama. So you're using a drama in order to change the way that people thought in Bangladesh. Here it is. It's called Sailing Against the Tide. It resembles many primetime family dramas with storylines around the themes of falling in love, marriage, and the important role that mothers-in-law play in Bangladeshi marriages. But the production team also weaves key elements of health knowledge into the dramatic arc, such as the recommendation that 4 antenatal childcare visits are ideal for the pregnant mother. And it goes on to say that that program is closely linked to a follow-up discussion show after the drama, in which some of the characters from the show, a medical expert and a real-life contributor, review some of the key issues explored in the episode. So very vulnerable people, I would suggest, in Bangladesh. BBC using them for an experiment to see how they can apply mass media to change how they think about medical matters. And of course, that is exactly what's happening in this country around the application of vaccines, where the line from the BBC is simply, take the vaccine, we're not going to talk about risks.
Now, Alex, we've been sent an interesting photograph. I believe this is a sign on the door of, well, who is it the sign on the door of?
Is a French member of parliament, member of the Assemblée Nationale. The person who tweeted it is a very big hitter in French law. He's Maître Di Fabrizio, who is leading the challenge on vaccine passports, in which France has taken many strides forward to totalitarianism, as we've been covering. So the top line has been cut off where the name would be. After that, député, member of parliament. Below that, bureau parlementaire, so my parliamentary office, opening hours, first floor. And then the key bit, which has been ringed in red, la permanence est interdite aux animaux et aux personnes sans passe sanitaire. Admission will be refused to animals and to persons without a COVID pass. So Maître Di Fabrizio, in tweeting this, said that for the sake of decency, which I think is pretty too gentlemanly of him, he's not naming the French member of parliament involved. Meanwhile, down on the French
Hold on, Alex.
Riviera,
Alex. I just wanted to say it was interesting to me that animals came first. So he seemed to be putting those without a COVID pass below animals.
Well, Mike, you'll recall, the old
Yes.
chatter there used to be in Ireland about the London and Birmingham bread and breakfasts in the 50s, 60s, 70s that had these signs before it became illegal: no entrance to blacks, dogs, and Irish. And that was, of course, a pointed insult at particularly the Irish. And that seems to be what's going on. But down on the French Riviera, this tip also comes to me from the same associates, the stalwart Georgia Pouliquin. Nice Matin, one of the big papers down there, is reporting that in no less a city than Toulon, Brian will know it as the base of the French Mediterranean fleet, these billboards have been going up. Emmanuel Macron dressed up as Adolf. His party, La République En Marche, has been symbolized as if it would be a swastika with the white, red, and black color scheme. And Mr. Macron, Adolf Macron's slogan is "Obéis, fais-toi vacciner." Obey and get yourself jabbed. There might not be chance that this is in Toulon, of course, because the French Mediterranean fleet has a less than glorious wartime collaboration record, and this may be their way of expiating their sins in the local community, shall we say.
Yeah, but it's not just the French parliamentarians that are taking arrogant positions.
No, so let's have a listen to this. This is from the 15th of July. This is Vera Hobhouse, W-E-R-A, Vera Hobhouse. She's originally from Hanover, a very posh town in northern Germany. She's married into an English family, Mr. Hobhouse, and been in Britain since 1989 or so. But here we are. She's speaking to the, effectively to the leader of the House, the Controller of Government Business and Commons Time, Jacob Rees-Mogg. We've cut out his response, but we just want to listen to what Vera Hobhouse said. So if people were thinking French MPs are more arrogant about this than ours ever would be, admittedly, this is a foreign-born one, a German, quite noble lady, so perhaps a bit blunter than a British-born MP would be. But here's what she had to say on the same theme of COVID sanitary measures.
Speaker, a contributor this morning on Radio 4 said it's only ever posh people who say that the less fortunate people in our communities don't want to be told by posh people what to do. In fact, they do. Or they want to at least get some responsible guidance, and the complete abdication of responsible guidance from this government I find shameful, and I indeed, Mr. Speaker, will continue to wear a face covering in this chamber.
So, for those listening in audio only, you might not have fully appreciated that the head rolling, the head shaking, the eye rolling, and the shoulder heaving was part of the, dare I